In a world where there are so many sources of information on women's health and reproductive health, I pride myself on being a reliable source for those women and being able to provide that on a day-to-day basis. I'm Dr. Miriam Goma, and I'm a gynecologist and obstetrician with Johns Hopkins Medicine. I take care of women across all phases of life, from pregnancy to surgical care, menopause to abnormal bleeding. I became a physician because I grew up with a brother who has many disabilities. I helped guide my parents through care for my brother as they were navigating a new system as immigrants in the United States. That experience shaped me and allowed me to become the physician I am today. When I was a medical student, I became a patient myself and was taken care of by world-class obstetricians and gynecologists who inspired me to pursue the field. I have a special interest in minimally invasive surgery and in health equity. I take important pride in caring for patients across all walks of life and different socioeconomic statuses and backgrounds. My philosophy on patient care is patient-centered. I prioritize patients having the autonomy and empowerment to really advocate for themselves in the healthcare setting and really make an effort to include patients in all their decision-making. Outside of work, I'm a writer and an advocate for women across many different platforms. When I was a resident, I worked at the American College of Obstetricians and Gynecologists, advocating for women's rights on the Hill and speaking to legislative representatives about women's health and women's rights. I've also written for multiple media platforms, including major news sources about women's health, reproductive rights, and all of the rights that women deserve. When I meet a new patient, I always try to take the time to understand your experience with women's health and a gynecologist. We take the time to really understand together what your level of comfort is with the exam, procedures, and more. And based on that, I try to approach things with a trauma-centered approach, knowing that everybody's experience with a gynecologist is different and comes from a different way of life. I take a community-centered approach when thinking about women's health and reproductive care. It takes a village to raise a woman and, of course, to raise children, and together we can offer that care to each other. As a physician who has been in the DC area for many years, I'm excited to see Johns Hopkins establishing world-class care for a diverse and ever-growing patient population in the DC area.